Hello, my name is Dr. Daniel Bruns, and I am a pain psychologist. I teach physicians about the nature of pain, and I teach my patients how to cope with it. Now here's a riddle that'll stump you. Where is the edge of pain? Boy, now that's a bizarre question, isn't it? Where is the edge of pain? But you know, over the years I've practiced, I've had a conversation at least 100 times with patients, probably a lot more, that goes something like this. I would notice that the patient is taking large doses of opioids, and even dangerous levels. And I would say, so what's your pain level? Well, it's a 10. So why do you keep taking the opioids then? If your pain is a 10, they can't be working. And they would say, well, no, if I take the opioids, my pain is still a 10, but I take the opioids because it takes the edge off of the pain. It takes the edge off. I struggled with trying to understand what they were talking about. Where is the edge of pain? I must have missed that day in anatomy class because I never knew where the edge of pain was. So it took me a while to figure this out, but what my patients were talking about. So where is the edge of pain? Out on the periphery of the body, there's all kinds of sensory receptors and pain receptors. This picture shows a cross-section of receptors in the skin. Is that where the edge of pain is? I don't think so. Let me explain a little background information. According to the International Association for the Study of Pain, pain is this hybrid experience, which is part sensation and part emotion. So all pain is part emotion. You imagine yourself in a kitchen and you touch a hot burner and you say, ouch, damn it! What did you just hear? There's sensation, the ouch, and the damn it, anger. And these experiences are wired together in our brains. Pain and emotion share many of the same neural pathways in our brain. Now, in acute pain, the pain experience is primarily related to nociception, and it's a sensory experience. In chronic pain, though, emotion comes to play a dominant role over time. Let's think of this more simply. In acute pain, that's pain that lasts less than 3 to 6 months. The ouch is more important than the damn it. But in chronic pain, the damn it is more important than the ouch. It has been my experience with patients that when they refer to medications taking the edge off, what they're referring to is the emotional edge. The edge of pain is in the limbic system, the part of the brain that deals with emotion and distress. And opioids, remember, produce euphoria. And so when patients say, well, it doesn't relieve my pain is still a 10, but it takes the edge off, they're talking about not the analgesic effect of opioids, but the euphoric effect of opioids. And the euphoria takes away the emotional edge of anxiety and depression that's often associated with pain. So where is the edge of pain? The edge of pain is in the brain. More specifically, in the brain's emotion center. If you want to know when more riddles and other videos will be posted, subscribe to the healthpsych.com YouTube channel.